Together we achieve victory over heart failure.
Hello and welcome to our podcast. I am Dr. Ranjeet Patil, intervention cardiologist at Baner Heart Institute, Pune. Today we are going to have a discussion on a silent epidemic that India is facing, that is heart failure. In India, majority of the patients suffering with heart failure are surprisingly young individuals, and it's common occurrence in those at the young age, as we are seeing the patients in our day-to-day clinical practice with heart failure, unlike in the Western world where most of the heart failure patients predominantly are the elderly. Now let's break down the five essential insight in heart failure. Firstly, what does it mean when a doctor tells you that you have heart failure? When people get a diagnosis of heart failure, they think that it's the end of their life. The term heart failure can seem frightening, but it simply means that your heart is struggling to pump the blood and effectively as it should. The ejection fraction, that means how well your heart pumps the blood, it is mentioned in the blood pumping capacity of the heart, that is low. Normally, ejection fraction is between 55 to 70%. Whereas in individual with heart failure, it can be as low as 30% or even lower than this. Secondly, why so many Indians are affected by heart failure? Probably because of the genetic, and we are having risk factor of heart failure like hypertension, diabetes, obesity, smoking. Because of the hypertension, diabetes, obesity, smoking, we are more and cholesterol related issues. We are more prone for ischemic heart disease, and probably that if not treated properly, it leads to heart failure. Moving on, what are the insights and symptoms of heart failure? So watch out for confusion, fatigue, palpitations, fast beat, heart and heartbeats are fast, nausea, shortness of breath, awakeness, sleep disturb pattern changed, frequent urination, loss of appetite, vomiting. How can we protect ourselves from heart failure? So our heart work incredibly hard to keep us alive. So these are the five golden rules which we can follow to return for our heart health. That is early detection of heart failure and by regular blood test and your regular clinician's visits. Dietary adjustment to maintain the heart health, particularly to reduce the salt intake in the diet. Incorporate daily exercise into our routine. Practice the stress management technique and quitting alcohol, tobacco, and smoking in any form. Lastly, what comes next after the heart failure diagnosis is, thankfully, medical science has offered numerous treatment options. It is possible to live an healthy, enjoyable, meaningful, productive life even with heart failure. Heart failure medication improves quality of life and longevity. Device like biventricular pacing pacemaker implantation, cardiovascular defibrillator implantation, valve repair, bypass surgery, or at time the heart transplant are the option for the heart failure management. The lifetime risk of heart failure is 1 in 5 in both men and women. Remember, awareness and preventive measure can help us to be safe from our heart failure, and treatment measure to take regular medicines if we are having it. Thank you.